Earlier today, President Biden signed an executive order he says will protect access to reproductive health care services in states like South Carolina trying to restrict them. It comes 2 weeks after the Supreme Court's decision to overturn Roe versus Wade. The order charges various agencies with coming up with new policies that could be enacted in favor of abortion rights. That includes protecting access to birth control and abortion medications, and it aims to protect patients' privacy and health-related data. News 19's Becky Buds has more on what Biden's order means for our state's future abortion laws.
With the stroke of a pen, President Joe Biden signing an executive order to protect reproductive rights nationwide. Biden's action comes as a growing number of states like South Carolina are considering laws to restrict abortion services. The state's current law bans abortions after a heartbeat is detected or at about 6 weeks. However, lawmakers are considering completely banning the procedure. Biden doesn't have the power to overrule South Carolina or any other state's law. The order says federal health officials should push back on efforts to limit access to abortion drugs or to travel across state lines. University of South Carolina political science professor Kirk Randazzo explains the executive order is expected to have a limited impact on South Carolina.
It is very likely that this executive order will come into conflict with that new law, and then we'd have another round of litigation in the courts to try and figure out if the federal government has authority over this issue or if states do.
Representative John McCravey is the chairman of the House Abortion Ad Hoc Committee and is in favor of a total abortion ban. He calls Biden's order unconstitutional.
It's been left to us as the state of South Carolina to determine our own laws with regard to this, and we're determined to do that.
Director of Public Affairs for Planned Parenthood South Atlantic, Vicki Ringer, welcoming the order as her organization wants abortion rights, but says the future of abortion access remains uncertain.
So this is promising, but we know that we're dependent on our legislatures and our courts in South Carolina to have any real meaningful protection for patients.
Representative McCravey tells me his committee will meet again in about 2 weeks. Meanwhile, the Senate is planning to hear public testimony on their bill in mid-August. Reporting out the State House, Becky Buds, News 19 WLTX.
Becky, thank you. Looking at abortion law efforts here in South Carolina, the state Senate's bill would make it so that abortion drugs would not be an option. Medical providers would only be able to abort a fetus if the mother's life was at risk. And a doctor's license could be revoked by a medical board if they're in violation of the law. Right now, the fetal heartbeat law is South Carolina's abortion measure. The law outlaws most abortions after 6 weeks, which is before most women know they're pregnant. There are exceptions for rape, incest, or to save the mother's life.